Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal fetal medicine specialist, which just means a high-risk pregnancy doctor. And today I'm joined by Sierra Malkovich. Sierra, welcome.
Hello.
How are you?
Good. How are you?
I'm doing good. Welcome to the show. It's very nice to have you today.
Oh, thank you. I'm happy to be here.
All right. So if you could, please, for our listeners and those watching, give us a little introduction as to who you are.
So I'm Sierra Malkovich. I'm originally from Vermont. I moved to Arizona just about 10 years ago. Married 2 years, and I have obviously two. I have twins, and there's
two twins or just one set of twins?
Yeah, one set of twins.
One set of twins.
2 boys, twins, fraternal twins, 17 months old. And yeah.
I love it.
Yeah.
I love it. And tell us really quickly, because part of this too, not just about pregnancy, and we're going to dive so deep into the twins too, just because I think it's going to be such a fun topic. But as far as working while you were pregnant, particularly because you were carrying twins, did you find that stressful, challenging, hard?
You know, luckily I got pregnant in February 2021 and it was COVID still. And our company had went full-time remote. So I was still working remotely. So I got pregnant in February, and then by May they started to implement come back to the office 1 to 2 days a week. But by then I was considered high risk with the twins. And luckily my bosses were amazing.
Nice.
I had already established a really good relationship with them and kind of reputation with my job.
Yeah.
And my job on what I do day to day is very remote driven. I don't really need to be in an office. So luckily the minute they found out I was pregnant, then I was having twins, they're like, stay home.
Yeah.
So it was awesome. So,
I love it.
Yeah.
And so she mentioned the term high risk, and some of the stuff we talk about in some of the videos I have are about what makes a pregnancy high risk versus not high risk. When you found out you had twins, you didn't know, you didn't go in going, oh, I know I'm having twins or anything.
No,
you went in
not at all.
and I think I'm pregnant. And then when did you find out from going in and thinking you're pregnant to oh, I have twins?
Yeah. So the first appointment, which was an ultrasound. So I found out I was pregnant 3 weeks, which I was obviously super early. I was very regular. So that Friday I was supposed to get my period.
You were only 3 weeks along when you
when I found out.
Oh my God. That is super early. That's awesome.
Yes.
That's awesome.
And I think the line was so strong. I mean, I had taken 3 tests, one including that said yes, and then 2 of the lines.
Yeah.
Because my hormones with the twins.
Yeah.
But of course, I didn't look pregnant. I didn't feel pregnant.
Yeah.
We were shocked. We were like, oh my God. And you have your first appointment around 8 weeks. So for 5 weeks, I was like, oh my God, I'm pregnant. With one. We didn't even think about the thought of twins. We didn't even joke about it.
No.
So that first appointment, I mean, I didn't feel it. I didn't look it. And I honestly, I had this weird feeling of okay, I can't look at the screen because what if she doesn't hear a heartbeat?
Oh,
I don't want to think devil's advocate, but
right.
I almost didn't want to get too hyped up.
Yeah.
And again, it was just weird because I didn't feel pregnant. I didn't look pregnant. So, and luckily Billy travels a lot for work, my husband. And he actually wasn't going to go to the first appointment. I'm like, oh, it's fine.
Yeah.
I was more like, you don't need to go. She's just going to confirm I'm pregnant.
Yeah.
And thankfully I have another OB friend, and she's like, no, he needs to be there. And which I'm looking back, I'm like, oh my God, I would have died. I mean, I had to find out I was pregnant by myself because he was on a bachelor party that weekend.
Oh my God.
So I'd already had to find out I was pregnant by myself and then hold it for 2 days. And obviously when he got home, I told him.
Oh, you didn't tell him on the phone or anything? You waited till he got home?
No, because with the time change, he was already drunk at the bars. And it would either have made him drink more and not want to come home. Or I just, and I really wanted to see his reaction in person. So that was hard for me to kind of keep it to myself. It was 2 days though. It wasn't too bad. But then
That's a hard 2 days probably. Just this kind of
and then when he got home, he was so hungover. He wanted to just eat pizza on the couch. He was wanting to fall asleep. And I'm I came up with this fun little way of telling him.
I love it.
So fast forward to our first appointment at 8 weeks. So my friend was he needs to be there. So and luckily, so we crammed in this small little room. I lay on the table. I'm so early. It's not the ultrasound on my belly. She goes into my vagina.
The vaginal probe.
Yes. And she had made some kind of noise sound where it was okay.
Yeah.
So when I looked at the screen and she's like, okay. She's like, well, there's one. And Billy and I we were what? And she's like, and there's the other. And I swear to God, I thought she was going to say, and there's the third. Because I'm like, where are we going?
You already kept going once. Yes. Like, when are you going to stop? Yeah.
And I looked at Billy and he just goes, oh, fuck. And I was still like, wait, what? Like, I was still so confused.
It wasn't really resonating at the time.
I could not comprehend what she was saying. And she's like, yeah, you have 2 healthy babies in you. And
Billy, what did you do to me?
Oh my God. I just started laughing. Like all the emotions came. Yeah. Then I started crying. It was a happy cry. Yeah. It was like, oh my God, I am going to be so big. Like my belly. Like how is my body going to carry 2 babies?
Yeah. But you did rock star great. Like,
and
insanity.
I am tall. So that helped. Like I never had like acid reflux. I never had like my ribs move. And I was told after that I had a very long cervix. And my OB was like, ooh, you're made for twins. And I'm like, well, I don't know if I would go that far, but that was a good thing.
That was a good thing.
Obviously reduced the risk of preterm labor. So
okay, so we're going to come back to twins too, but since you brought that up, I have some questions, and anyone who's been watching this before does know as well. I asked everyone the same 10 questions, and the guests have no idea what the questions are. Okay. True? Like you don't know these questions. We haven't talked about these. Nope. Okay, question number 1.
Okay.
What does the abbreviation OBGYN stand for?
Oh my gosh, I have no idea.
No, not even a guess? Because you went to an OBGYN for your pregnancy, right? You had an OB.
I did.
Okay.
I mean, if I knew, I wouldn't even be able to pronounce it.
There you go. No worries. So obstetrician and gynecologist.
Okay. Oh, gyno.
Or obstetrics and gynecology.
Yes.
I know.
Okay.
I know. We abbreviate everything in medical field in general. So
because all the words are like yay long.
Too long. And too long. Okay. Question number 2. What do the letters MFM stand for?
Oh gosh, I remember seeing this too. Oh gosh, I don't know.
That's okay.
I'm so bad.
Maternal fetal medicine.
Okay. Yep. All right.
Yep. So that's what I do. So
okay.
Yeah. So people are, and I always tell people, they're like, oh yeah, everybody kind of knows what, if it's like your friend or family, they know what you do. I'm like, no, they don't.
Yeah.
It's too much. It's also called a perinatologist.
Okay.
Which I feel like MFM is easier.
Yeah.
Right. And then sometimes I just say a high risk OB doctor.
Yeah.
Right.
Okay.
I mean, that's easier. I feel like, I don't know. There's so many different ways to say it.
Maternal fetal medicine.
Yeah. So mom, baby, right? Or maternal things.
And then medical field.
Okay. And then like also, I think they throw the medicine part in too, because if people hear maternal fetal, it's like, oh, so then they have to see someone else for the medical issues. The way that I kind of say it is like, I feel like I'm an internal medicine doctor for pregnant individuals. So like if you have asthma, high blood pressure, those things. And then if you have things like maybe certain types of twins too.
Yeah. Right.
But it can just be like the patient themselves has like diabetes type
issue.
Yeah,
yes.
Exactly. Yeah, so that's where the medicine comes in. Yeah. All right. Question number 3. How does a provider come up with your due date when you're pregnant?
Oh, I mean, I think tracking from like when what is it usually like last period started.
Yeah. That's it. That's exactly it. Yeah.
Okay.
Period, and then ultrasound, and then
and then the growth of the baby, and yeah.
Okay. So next question here: when is a pregnancy considered term?
Is it 30 weeks?
37 weeks.
Oh, 30. Oh, duh. Okay. Yes, that's right.
But the due date is when you're 40 weeks pregnant.
Correct.
Now,
yes.
For you having twins.
Yep.
You don't go to 40 weeks. That's not a thing. So anyone listening, if you have twins and you're like, oh, I'm going to go to 40 weeks. If your provider tells you you're going to 40 weeks with any type of twins, find a new provider.
Yes.
Because that's not a thing.
Yeah.
So like, question for you two. Did someone explain to you early on, like, hey, your due date is February 1st, but you're going to have babies before that? Did they explain that to you?
Yeah. I want to say my original due date was like November 7th or 11th. I think November 11th. No, it was 11/7. It was November 7th. We won't let you go past 38 weeks. So then my new due date was October 24th or something. And then we had right then and there scheduled like a C-section.
Yeah. And we have these like videos about what is my due date, because it can be so confusing.
Oh,
like,
yeah.
Your due date doesn't mean that's the day you're going to deliver.
Right.
That's the day your pregnancy is 40 weeks.
Yes.
Whether it's twins, triplets, a singleton, which is just one baby, the due date is 40 weeks and 0 days exactly.
Yep.
But it doesn't mean you're going to deliver on that day.
Right.
So
correct.
All the different things to think about. Okay. Question number 5. What is the normal fetal heart rate? So like when they're in your belly before they're born, do you remember what their heart rates were?
They were always great, which that was always like such like an anxious time for me. But then I always left every appointment like so relieved. Like their heartbeats were good and normal range.
Yeah.
I had is it 150, 160?
Yeah. Between 110 and 160. Yeah.
Okay.
Much higher than ours. You know?
Okay.
So yeah. Awesome. I love that. Okay. And then question number 6. What is antenatal testing or fetal well-being testing? Have you ever heard that term?
No. Does that correlate anything to the 20-week mark when you do the anatomy full scan or?
No. Did they for you ever put those belts around your belly?
They were called the NSTs.
NSTs, yes. So there's so many weird terms, but we use either non-stress test, which is the NST, is a form of fetal well-being testing.
Oh, okay.
Or antenatal testing, yeah. Did they ever do something called a BPP for you? Do you remember that term?
Yep.
That's another form of fetal well-being testing.
Okay.
It's just confusing as to what it is. So there's a YouTube on that, guys, in case you're interested. Yep. It's like, what is fetal monitoring? What is antenatal testing, fetal well-being testing? We call it multiple things.
Okay.
And then we usually either do an NST, a non-stress test, or a BPP, a biophysical profile.
Okay.
Everything goes down into 3 letters all the time. Yeah. Like it's like BPP, NST, AFI, we can't say the full word. It's too much.
I know.
It's too much.
It's too long.
Okay, question number 7. How does an ultrasound estimate the weight of a fetus?
Oh, gosh. Oh, by the measurements.
Yeah. They measure the head, the belly, the arm, the leg, that kind of stuff. Yep. Perfect. Good job. Question number 8. What makes up amniotic fluid?
All of the fluid I drink. And some.
So you actually bring up a really good point. When people have lower fluid around the baby, we do tell them to drink more water. Yeah. That's a true statement. Mm-hmm. The actual thing that makes the fluid right there is baby pee.
Oh, interesting. Yeah. Okay. But which I guess in a way, what I drink, they pee.
There you go. Because if mom is dehydrated, if the patient is dehydrated, then you don't have as much fluid going through your kidneys, you're not processing, et cetera, et cetera. So then you're not going to end up having a fetus that would make as much amniotic fluid.
Yep.
So when people are really dehydrated, I always tell them drinking water actually helps quicker than an IV over time if you're doing it regularly.
Yep.
But some people just can't drink that much at one time. So they go and get an IV and stuff like that.
Yep.
So dehydration can lead to that. That's actually like a great answer because it's indirectly the exact answer.
Yeah.
Yep. I love it. Okay. Question number 9. Who should be offered Down syndrome screening when they're pregnant?
Isn't it anyone over 35?
It's anyone, period. Everyone.
Oh, really? Okay.
Yeah.
Oh, yeah, I guess you're right, because we had that.
Yeah.
With like 2 others.
Yeah.
Like around the 10 or 12 weeks.
Yeah,
maybe?
exactly.
Yep.
So when they sent, how did they approach you with that? Because that's been a topic with a bunch of guests. Like, they sent my blood. No one told me what it was for. I didn't really know what testing I had. Do you remember before you had that done that someone said, hey, do you want Down syndrome screening? And if so, here's how we do it.
My husband and I are very vocal and just right to the point. So we just asked them. I mean, that was even pre-knowing we were going to have twins. Whether it was a singleton or twins, we for sure wanted all the genetic testing. We didn't do the full palette of genetic testing. I know there's something where you can do like, it can test you for like over 200 diseases that you and your, because that was not, there's like just a chance or something. Mm-hmm. But we for sure wanted like the Down syndrome and then the 2 other ones that they test. Yeah. So we like raised our hand early to ask. Good. And then obviously followed up. Yeah. But
did you feel like, because that's part of the whole point of what I'm doing is trying to educate people to ask the right questions, right? So like, if you hadn't have been that person that felt strong enough, and because some people, I feel like there's a little bit more of a like, I'll do what my doctor says, right? 100%. Or like, I don't know enough to think to ask a question. Right. If you had information prior to, or I guess if you didn't have information prior to, and you could find it, would that have helped you? Like if you weren't initially like, I'm going to ask for that.
Yeah. Oh yeah. You don't know what you don't know. Yeah. So I think anything out there, whether, any type of material, whether it's a pamphlet or a website for you to then take the initiative to go on the website to view it yourself, or just a questionnaire that you're required to fill out or something to make sure that you have at least viewed it and then made your decision of like, oh yeah, I'm good. I don't need to ask that question. Yeah. Or, oh, that's a good point. I should bring that up.
Yeah. When you say genetic screening, I guess I think that's a term we throw around a lot, like genetic, right? And so what Sierra's talking about too is probably what we call carrier screening, where you can see if you carry
like cystic fibrosis.
Yes,
or something.
That's a perfect example. Because if Sierra were a carrier, then her partner could be tested. And then if they're both carriers, there's a 1 in 4 chance of having a child with the disease.
Yes. And then isn't there something where like, at the time you can like term the baby, but then you're not quite sure. There's this like weird lapse time of like, well, you're not sure if the baby will have that until they're later on into the pregnancy.
And there's a lot of things that you might never find when they're in the womb, right?
Right.
And then genetically speaking, we have this cell-free DNA screening, which is the test for Down syndrome. That's thing 1. Thing 2, there's carrier screening, which is what you mentioned, that you can do a few things or you can do a larger panel. The larger panel we really do for people of Ashkenazi Jewish descent because they have a higher rate of being a carrier. And I've had someone on recently that she and her partner were both Ashkenazi Jews.
Oh, wow. Okay.
So they definitely did the testing before becoming pregnant.
Yes.
So that they knew what their risks were of having a child, with these possible disorders. And then there's a third layer of, if we want to test for everything that could genetically be of concern, we have to do invasive testing like an amniocentesis.
Yes. Right.
And everyone should be offered an amniocentesis just so they know, hey,
we offered it to you.
Yeah. And then if you don't want it, that's fine. But if you want to look at all the chromosomes, that's what we have to do. And I do tell people now we're doing the amniocentesis, which is the needle that goes through the uterus into the amniotic fluid, pulls it off, sends it to a lab. Takes about 2 weeks for results. Even when we send that, you need to know what your doctor sends because they can send a karyotype, which just looks at the big chromosomes, a chromosomal microarray, which looks at the small detail. And now they can do full exome sequencing.
Oh my gosh.
Which is like even a closer look. I mean, the problem with that is insurance probably won't cover it. And you're looking at $5,000 to $8,000.
Yeah. Oh yeah.
So, because I know you have 18-month-olds at home.
Yes.
So I had a friend recently, a friend from when I was younger, and she's around my age. So like early, mid 40s. I'm going to still call it early 40s.
Okay. Yeah, of course.
I'm going to accept that. It's not 45 yet.
Nope.
And she had her third kid and everything had gone great. They did the Down syndrome testing, using some air quotes because that's kind of the main thing that was really tested for. They declined an amnio because structurally everything looked great, right?
Totally. Yep.
She has a beautiful baby girl and she notices developmentally over time that the child just isn't meeting the milestones like sitting up, pulling up, none of those things. Yeah. So the muscles seem to not be working as well. She goes into a genetic counselor and there ends up being a micro deletion in this baby girl's genetic makeup. And nothing that would have been picked up on an ultrasound, nothing that would have been picked up on the blood test for Down syndrome.
Right.
So when I explain this to people, if you do that blood test, you're looking at 3 chromosomes. The big chromosome. I mean, chromosomes are small, but in the scheme of genetics, they're the bigger part. You're not looking at the tiny parts of it. So had she had an amniocentesis, this one would have likely been picked up. But would it have changed what she did?
I know.
Right? And that's what we get into the counseling on patients. Like, had she at least kind of understood more, hey, an amniocentesis could pick up small things that could help you know if your child might have delays and all these things. Her child, I think they were told she might not walk, and she's gone through physical therapy now and is taking steps.
Oh, good for her.
You know?
That's amazing. Yeah.
Like, so there's still things to do, but I think it's part of that, like, do people like surprises, right? Like I always tell people I like surprises on my birthday, which is only one day a year.
Yes.
Other than that, no gracias. Like I don't want that.
Yeah.
I feel like knowledge is power. And if you understand it and choose not to go that route, what do you think about that?
I mean, I'm an avid planner. I mean, I think that is one of the reasons why I am so successful in having twins. I mean, first, I don't know any different.
And you have a cervix of steel. So
yes. I mean. So that was a breeze. But yeah, I mean, for me, I love giving surprises, but I would not want a surprise with my children.
No. And no one likes surprises. And I do tell people too, when I talk to them, I don't want them to if they want surprises, then let me know. But, you know, I'm going to be the person that tells you all the possibilities so that you don't get a surprise. Right. I'm going to over counsel, you know?
Right.
I agree with that.
You never want to be on the other side of like, well, why didn't my doctor ever tell me this?
Exactly. Yeah.
And then it's like, well, it's too late. You know, I'm like, oh my God. And then what are you going to do? Well,
exactly.
Your options are a lot more limited.
That's right. Exactly. All right. Here's our last question. This is question number 10. What is considered a normal cervical length or length of a cervix in pregnancy? So that 20-week scan that was like your anatomy scan, you know, do you remember, because I know you said it was very long.
Yeah,
did they tell you how long it was?
Oh my gosh. It's like 10.
If yours was 10, I want to know, because that is fantastic. That is fantastic. It could have been. Usually we want it above 2.5 at least centimeters. So 3 centimeters and above is great. So it definitely, yours had to have been above 3 centimeters, it sounds like.
Yeah, I know. I don't really remember. No, then it's not going to be 10. That would be way too long.
It would be crazy. I mean, it would be like, I guess it's possible. But yeah, you could have been 5. I've seen 5 before
then
for some
people. Then now that I think about it, I feel like I was like 4 or 5.
There you go. And that's fantastic. Like, that's absolutely fantastic.
And then as I approached, my 37 week, it was always like, how's the cervix looking?
Yeah.
And my cervix always looked really good. So.
And when you bring that up, here's something for the listeners too. A cervical length should never prophylactically, like just for looking purposes, be measured after 24 weeks, because it could be shorter, and it statistically from the data we have doesn't necessarily mean anything. So that's for like just looking willy-nilly. Okay. However, if someone shows up with contractions and they think they're in labor, then we oftentimes look at the cervix after 24 weeks to help guide whether we keep them in the hospital, whether we send them home, stuff like that.
To do. That makes sense.
Having an amazing cervical length in a twin pregnancy is huge, because if it's short, your risk of preterm labor is already higher just because you have twins. And now you have a short cervix, sometime between 16 to 24 weeks. And now it's like, oh my gosh, now that risk increases.
Yeah.
So when you delivered, did you make it to or beyond 37 weeks?
37 weeks in one day.
Yes, you did. Did you go into labor on your own?
No, God, no. The minute I found out I was having twins, I was like, C-section? My doctor was like, yes. I'm like, okay.
There we go.
But it would have not been a vaginal birth anyways. Baby A was breech, and then baby B was like side,
like transverse, sideways this way.
Transverse, yes. That was like the.
So see, you can tell that we're a great patient because you actually know the word breech, and you call them baby A and baby B, which is what we do all the time. Yep. A is always the one closest to the cervix, so lower down, and B is the higher up one. And you had both boys. Yep. So did they ever feel like when they were looking at him, when you were earlier on, that they couldn't tell who was whom, or did they stay in a good spot?
They always could tell.
Yeah. Good.
So,
good.
Yeah.
You had good ultrasonographers then.
Yes.
Because that's important. You got to know that.
Yeah.
Okay. So you said in the beginning when you found out you were pregnant and you were having twins, you were like, oh my gosh, I'm going to get so big.
Yeah.
Did you feel like you could tell you were having twins? Like, did you, I don't know, like from your body, were you like, man, if there was one in there, I would definitely not feel the way I feel right now?
It's hard to tell because it was my first pregnancy.
Yeah.
So, and I could go on and on about my pregnancy. I loved being pregnant. So, and I embraced like the tight dresses and the rubbing of my belly, and like, in a way, I was like, bigger the better. Like, I loved that. So I don't know. I mean, definitely towards the end, I was like, oh my gosh, like there's no way. I mean, I would walk into places at like even 28, 29, 30 weeks. So I still had, I still went 7 more weeks after that. Yeah. And people were like, do you have to go to the hospital now? And I'm like, I'm having twins. And I'm like, okay.
Okay. Do you find, and I know you said you embraced it. Did you see or feel that people were more, I guess, wanting to give you advice or tell you about your body while you were pregnant because you were pregnant? Like, oh, hey, like someone approaching you and just talking to you more and saying stuff?
No, I mean, I never had strangers. Okay. But I had friends and family. But a lot of advice that I had, which I would be the number one advice I pass on, is listen to your body. Yeah. Listen to your body. And like, you know yourself the best out of any doctor out there and out of any friend, mom. So just listen to your body and your gut feeling and
I tell people that all the time when they're like, is this normal? Like if a patient says to me, is this normal?
Yeah.
I always say, here's what normal physiology is for pregnancy. Here are some concerns it could be. Only you know if what feels different.
Yeah.
No one else can feel that, right? Yeah. So I always tell people too, for trying to advocate, use your words, right, as best you can. Totally. And if I can give you some vocabulary that helps you explain a sensation, because when someone says, I'm having abdominal pain, like when you're pregnant, if you say abdominal pain, okay, can you take one finger and point where it is?
Right.
Or is it everywhere?
Yep.
Does it go somewhere?
Yep.
Is it worse at night?
Yeah.
Is it more when the babies kick?
Yes.
Right?
Yeah.
Because it kind of helps. Did you end up having any pain or any kind of, or was it more movements that you could feel or any kind of, it sounds like everything with your pregnancy went like pretty smoothly.
It went pretty smoothly. I remember I was about 26 weeks, 25 weeks, and I had ligament pain.
Yeah.
And it was basically all the pressure and my uterus was stretching and just all the pressure because I had 2 babies. So, and everything was growing fast, I remember. And when I say listen to my body, it's more listen to my body. And if anything even slightly is, that's a little weird, ask the question.
Yes.
Ask the question. Like a lot of my doctors and friends were like, there's no dumb question, especially when you are pregnant with 1 or 2 babies.
Yeah.
Just ask it. Better be safe than sorry.
Yeah, for sure. For sure. And we've talked some with an ultrasonographer where we were understanding the difference between an OB and a high-risk OB and kind of what they do. Did you do all your care with an OB provider? Did you see a high-risk provider? How did that go for your pregnancy?
So ironically, my OB was a high-risk OB. And then, so it all worked out when I found out I was having twins. She just continued to be my OB.
Yes. Yeah. So that's for people listening to, there are some maternal fetal medicine specialists. All of us have to be board certified in OBGYN to then go forward toward maternal fetal medicine. But some maternal fetal medicine doctors still do total OB care, meaning they still see pregnant individuals and deliver them as well, which is kind of cool because they kind of have everything at one place.
Oh, totally.
You know, which is awesome. Okay. We have now 10 quick, just true, false questions.
Okay.
You rocked that first part.
Oh my gosh. Well.
All right. These are true, false. So true or false, a fetus can have hair in the womb.
Yes. Oh, true.
Perfect. True or false, a fetus can hear.
True.
Yeah. It starts around 25 weeks. They feel this it can feel the vibrations basically of things, the acoustic stimulation. Question number 3, if a pregnant individual eats sugar, this will wake a fetus up if they're sleepy.
I want to say false.
You're correct.
Yeah.
And everybody says a different thing. And here's what I mean, and this is just from literature I read over the years.
Yeah.
Sugar, just like in an adult, right? We get sleepy after we eat it.
Right.
Right.
Oh, yeah, that's true too.
It's not going to wake you up. And it's the thing of babies go through sleep cycles and nothing that you eat is going to change that.
Yeah.
You know what I'm saying?
I don't think that correlates to sleeping.
It doesn't.
Of the baby.
However, I hear patients come in all the time and their providers have said to them, drink a big thing of Gatorade or eat something really sugary before you go in for your ultrasound so the baby's moving good or whatever. Or if the baby doesn't move, drink orange juice. It kind of irks my soul because... So imagine you're at home. Did you ever have any instances where you didn't feel the babies move?
No.
Good. That's awesome.
Yeah.
And I think
not to the point where I got worried.
Right. So if people don't feel babies move, I have heard stories of this happening. It's maybe he said, she said, this and that. But I was at home and I called my provider. They told me to drink sugar and then call them back in an hour or 2 if I still don't feel the baby move. That bothers me.
Yeah.
Because if you don't feel your baby move, you go to the hospital. Period. Hands down.
I think so. 100%.
You can call your provider on the way. Great.
Yeah.
But these stories I've heard have sometimes been stories coming from attorneys who are looking at a case because said patient called provider multiple times because they're the patient. They're looking to the provider for advice. Right. They're at home down in a bunch of sugary drinks. Yep. By the time they get to the triage area in the hospital, they might have a baby who's passed away.
Yeah, totally.
That's what bothers me. So if you don't feel your baby move, you go to the hospital. Yes. If your provider tells you to not go to the hospital, you tell them, I'll see a different doctor at the hospital. I'm going to the hospital.
Yes, 100%.
Yep. And you, again, as we said, your body, you know it best.
Yeah.
If something, even if there's decreased movement of the baby where you're like, man, usually it's more than this. It just doesn't feel the same or right. Yep. Get it checked out.
Yep.
All the
100%.
time. All the time. All right, let's see. Question number 4. True or false? Everyone should be screened for diabetes when pregnant.
True.
Do you remember your diabetes screening?
Is that the glucose
yes,
screen? Okay, yes. I remember I had to drink like a little thing.
Juice
yes.
thing.
And it was like 20-something weeks, I think.
24 to 28. Yeah. Sometimes earlier in twins. It depends. I've never drank. I have never ingested that drink or had that drink.
Yeah.
Does it taste as sweet as it sounds like it's supposed to taste?
Fine.
Okay. Some people tell me it's the worst thing ever.
My God.
And I'm like,
they
really?
told me that too. And I'm like, okay. And I'm like embracing
Prepared.
or like, bracing up for this like awful drink. It was fine.
It's like a shot, right?
Yeah. I mean, if anything, I was like, oh God, what is this doing to my babies? I'm like, I'm fine.
Right.
Yes,
okay.
It was fine.
Was it fruit punch flavored? I feel like everyone gets a different flavor.
Gosh, I don't recall. I don't remember.
But it wasn't nasty.
No, it was fine.
Okay.
Yes.
Perfect. I'm glad to hear that because I do feel bad when I write a script and have someone do it. And everyone and some of the patients are like, it's the worst thing ever. I'm like, I am so sorry. I didn't know it was that bad. No. Okay, so it's not that bad.
Stop being so sensitive.
There you go. I love it. I love it. Okay. True or false? Everyone should be screened for thyroid disorder when pregnant.
False.
Correct. That is false. Good God, you're crushing this. All right. True or false? Someone with 2 prior cesarean deliveries has to have a repeat cesarean delivery.
I don't know if it's like required, but I mean, I think 99% of the time it happens. And yeah.
I think you're probably right in saying that it's frequent. It used to be if they've had 1, they could still try. And now it's if they've had 2, they can still try. In certain circumstances, they have to be the right candidate.
Okay.
So yeah, that one's kind of, that's a hard one, I think. Mm-hmm. Question number 7, true or false? Twins that are the same gender are always considered identical.
That is false.
That is false because you have 2 of them.
Yes,
well, 1 set, 2 boys at home. So now I have to ask.
Yeah.
So they're not identical.
No.
Could you tell them apart right at birth? Were you like, oh, they look so different
not
to you?
Not so different, but that was like the one mystery surprise that no one could tell. Although we had really good images from the ultrasound where we knew that they had different noses, different facial structures throughout the ultrasound. So we were like, okay, these, and they obviously are fraternal, but there are fraternal twins out there. I always think of Mary Kay and Ashley Olsen. I mean, they look identical, but they're fraternal.
I didn't know that.
Yes.
They look so identical.
So when we found out we were fraternal, the doctor automatically was like, don't worry, they're not going to look alike. And I'm like, wait. Hey. You don't know that. Like the Olsen twins.
Oh my gosh.
But yeah.
I didn't know that about them. Okay, I'm so getting on the interwebs when we leave it. I'm going to be like looking into this. So when we're talking about the twins too, so your twins, when we say fraternal, basically we're saying that they have 2 separate sacs, 2 separate placentas.
Correct.
Is what you know.
Yep.
And when some people say fraternal meaning they're non-identical. Sometimes people colloquially use that. But here's the thing. If you have 2 separate sacs, 2 separate placentas, and the gender is the same, I can't tell you if they're identical or not until they're born. But if you have 2 separate sacs, 2 separate placentas, and they're different genders, I can definitely tell you they're not identical, right? There are some blood tests that aren't perfect, but that are pretty good for that type of twins that can come back and tell you if they're dizygotic, meaning 2 separate eggs, sperm that came together.
Okay.
Or monozygotic, 1 set of egg and sperm that came together and then split.
Okay.
So that test can kind of help. But when they're the same gender and they have separate sacs, separate placentas, you can't look at them and really tell
that it's fraternal,
that they're identical or non-identical.
No, correct.
Do you know what I'm saying?
Right.
Because that's where fraternal and identical is different than monozygotic and dizygotic.
Yeah.
And it gets kind of confusing. So I think when people say fraternal, so before you had the twins, did they tell you they were fraternal?
Yes.
They did?
Yes.
Then they probably could have seen on that blood test for Down syndrome that they were not identical. That's the zygosity.
Okay.
So did they tell you that early on?
Gosh, I want to say
remember?
They told me that at the 8-week ultrasound, that first appointment.
Okay. So if they did it at 8 to 10 weeks is when you can do that first blood test.
Yeah.
That blood test probably came back and said dizygotic.
Okay.
Meaning 2 separate sperm and egg that came together versus monozygotic, which is identical, meaning 1 egg and sperm that then separated and now they look the same because they're from the 1 egg and sperm.
But then if an egg and sperm got together and split, they can still split into their own sacs and have their own placentas?
Oh my God, such a good question. Such a good question. So when you have 1 egg and sperm, the day that it splits decides how close together in looking they're going to be or how identical they'll be.
Oh,
so,
interesting.
Yeah. So if you have 1 egg and sperm and they split early on, they will typically be dichorionic, diamniotic. So they'll have 2 separate placentas, 2 separate sacs.
Okay.
But they look the same still. They're still the same genetic makeup.
Huh.
However, if it's more like, so that's between 1 and 4 days.
Okay.
If it's 4 to 8 days, so the further out of the time in which that one little zygote separates, if it's 4 to 8 days, they're monochorionic diamniotic. 1 placenta, 2 sacs.
Yes. Okay. And that's that's high risk.
That's higher risk than the ones with 2 separate placentas, 2 separate sacs.
Yep.
Then if it's down toward 8 to 13 days, when that one zygote separates, then you have monochorionic, monoamniotic.
Yes.
Same placenta, same sac.
Yeah.
Those are very high risk.
Yes. Yep.
Then if it's after usually about 13 days that zygote separates, they're conjoined.
Oh, interesting.
Yes.
Okay.
And I've seen probably 4 cases of that in my career so far.
That was actually, I had never, okay. I guess I never
Isn't
really
that
thought
interesting?
about that.
No, I know.
That's how the conjoined twins happen.
Exactly. And it can be, it's confusing for a patient for sure. Providers, sometimes we don't always explain it well.
Yeah.
Because even like when I coach people for board exams, twins is always a topic that brings pause because you have to think about it for a second.
Oh, yeah. No, totally. I mean throughout my pregnancy, I had so many people tell me like, oh, for sure, no, that's the genetic. And and the identical, oh, that's random. And I'm like, okay, I can't even keep it straight. No. And I'm having the twins.
That's right. That's right.
Yep, bye.
Yeah. Okay, thank you. I appreciate that.
Yeah.
So it can be like, again, it can be very, very confusing.
Yeah.
So I'm so excited. I haven't met your twins yet.
Oh my gosh, you haven't?
I know. No, but I plan to do so soon. So maybe there'll be 2 soon. So maybe a second birthday party. Yes. I'll come give gifts. All right. Question number, let's see, where are we now? Question number 8. No cheese is safe to eat while pregnant.
False.
That is correct. Did you eat cheese while you were pregnant?
Yeah. I didn't eat blue cheese because you're not supposed to. But yeah, I ate cheese. Yeah. I mean, I ate dairy.
So here's my question for you. Did anyone talk to you about what type of cheese is okay to eat and what type is not okay to eat?
I mean, blue cheese was the big no-no because it's moldy.
The cheese is old and moldy.
Yeah.
That came from something like a Spanish.
Oh, yeah.
You know that the cheese is old and moldy?
Like a rhyme.
Yeah, right.
Or a song or something.
It came from something. Yeah, I don't know where it came from. So then what cheese did you eat then? Do you remember?
I mean, I loved cottage cheese.
Okay.
And I mean, cheese and crackers, cheese on sandwiches.
But do you know the rule or the reason why it's like don't eat certain cheeses?
I mean, it has something to do with like the dairy content in it, maybe.
It's if it's pasteurized or not.
Oh, that's right.
Yeah.
Yes. Okay.
Yeah. So like brie generally is not pasteurized.
Right.
Queso fresco is not pasteurized. That kind of stuff. But it's if they took it up to a heat high enough to kill listeria. Yeah. And so that's kind of why. So I always there's a whole video on cheese and pregnancy that talks about read the labels, right? Because if it says pasteurized, you should be safe with the bacteria had been killed versus unpasteurized. And people sometimes, if you just go on websites and look up cheeses and whatnot, it's very interesting because they're like, well, if you pasteurize a cheese, it's not going to taste as good because you get rid of some of the flavors.
Yes.
And I'm like, okay, but if you're pregnant, you might not get those flavors anyway, right? It might taste different. So just choose the pasteurized ones.
Yes.
For safety purposes. Yep. All right. Question number 9, true or false? Someone trying to get pregnant should start taking folic acid before pregnancy.
True.
Very good. And last question number 10, true or false? Baby aspirin is an over-the-counter medication that can prevent a certain type of high blood pressure during pregnancy.
True.
Did you take baby aspirin during your pregnancy?
I did not.
Did anyone tell you to take baby aspirin during your pregnancy?
No.
Okay. So fun fact.
Is that actually false?
No, you're true. Everything you said was great. It's totally true. You can go to preeclampsia.org. It's the Preeclampsia Foundation. My website has some stuff too, but you can look at like a checklist to see if you meet criteria to take a baby aspirin.
Okay.
Meaning, are you at high enough risk for getting preeclampsia?
Okay.
Which is a certain type of high blood pressure in pregnancy. Yep. Are you at risk enough to warrant you taking a little teeny tiny baby aspirin every day?
Okay.
And if you have multiples, twins or above, your recommendation is you should take it.
Is I should take the aspirin
while you're pregnant.
Because it lowers my blood pressure?
Nope. But this is such a great question too. It decreases inflammation in the small vessels, the ones you can't even like tiny vessels, right? It decreases the inflammation at that level. And we think that preeclampsia, at least part of it, is due to an inflammatory process in the body. So if we can decrease the inflammatory issues, then we should be able to decrease the risk of preeclampsia.
Huh.
So that's what it does.
Okay.
You start it around sometime from 12 to 16 weeks. And you take it once a day with food every day during the pregnancy. And it's so interesting. Some countries are actually using a higher amount. So not the baby aspirin, which is 81 milligrams.
Okay.
In the US, we're still recommending 81 milligrams. Some people have looked at certain studies from other countries and they're recommending a different amount. I don't do that yet because it's not technically the current United States recommendation.
Okay.
We're behind sometimes. So I get that. But, a baby aspirin once a day is going to be fine for people. Yeah. But they can check to see if they should take it. And the only time I've ever had someone say they didn't like taking it is they were prone to nosebleeds.
Oh, yes. Okay.
Yeah. And people in pregnancy are actually more prone to having nosebleeds.
Oh, interesting. I never got a nosebleed.
Yeah,
but
it's like a thing. And we live in a drier place too. So you could have for sure. But yeah, it's kind of like a thing.
That's interesting.
Yeah.
I had a girlfriend, she was a little older. 35, 36 when she got pregnant. And I feel like they directed her to take aspirin every day.
That's another risk factor. Yeah. Yeah. And the reason we get so jazzed about preeclampsia is because number one, it's one of the few things we can actually try to prevent. And it's not a magic pill, but preeclampsia, the side effects, if it gets bad enough, stroke, seizure,
Well,
heart
I had
issues.
postpartum preeclampsia.
What?
Yeah.
Man, I wish you would have been on aspirin.
I know. So I had an amazing pregnancy, but they took baby A out. He was great, wrapped him up, showed me. I was like, okay, he's cute. And then And my C-section was a scheduled C-section on a Wednesday. I went in to get an NST on Monday at 1 p.m. I'll never forget. Worked from home, went to go to NST, and baby B had kind of stopped practice breathing. And by that time, I went into that appointment being like, can we just do the C-section today? It's 2 days early. I'm already 37 weeks. Like, we're good. They're like, why don't you just go up to the hospital for further testing? And then I go into the room and they're like, all right, let's have some babies. So it was a little bit of a rush as far as 2 days early, but my husband – this is a crazy story too. He was actually in the middle of resigning.
Oh my gosh.
With his boss. And I called him.
In a meeting at the time.
Yeah. And they we're still doing the small talk.
Yeah.
And he's like, actually, so we have to postpone this. I actually have to go get my babies. So, so he comes in and he is like anti-blood, he is not medically, folds up his work clothes and is like, let's do this. Which was good. Looking back, it was good that he was just thrown into it. Leading up to the entire pregnancy, I'm like, are you going to cut the umbilical cord? He's like, absolutely not. And he ended up, it was all just like, do this, Billy, do that. So he was just like taking direction.
Yeah. And you can plan as much as you want, but it's the baby show. That's what I always tell people.
Yes, at the end of the day.
Plan, but
yeah. You can plan my car seats and diaper bag were in my car, but none of my hospital stay was. So. Okay. But it was fine.
Yeah.
My biggest priority was, are my babies safe? Let's keep them safe. So wheel me into the OR. They take baby A out. He's good. Weirdest feeling ever because I don't feel anything down there, but I immediately am like, oh my God, I feel so much lighter. Which that was such a
like
weird,
a pressure, like a weight lifted. Yeah.
And then they got baby B out. I heard him cry and I passed out. And my husband, thought I died.
You legit passed out?
Yeah, I died. I died. I passed out on the OR table.
So so now I'm going into doctor mode really quickly when you say this. So you heard baby B take the scream and you're like, oh, good, baby is healthy. And then what's the next thing you remember?
I don't remember anything.
Nothing.
I do remember Nash, baby B, coming out and hearing him cry. Because it's just like when you're having one or three, you just always want to hear a baby cry. I think that's kind of one thing I've always been kind of told.
Yeah.
And I don't remember anything. I remember waking up so cold. And oh my gosh, after I have these babies, I was a balloon.
Okay, so for someone listening to, tell us where you were swollen, because I know what I'm thinking when you say balloon, but where were you swollen?
I couldn't wear my flip-flops home.
Okay, so your feet for sure.
My legs looked like logs.
Legs. Hands?
My hands.
Yeah.
I felt when I woke up, I was throwing up, which was awful with a C-section.
Ugh.
I was really, really cold. So in a perfect world, I'd have the C-section. That's like a 10-minute procedure. The babies were out within 2 minutes.
Yeah.
And then someone comes in, stitches me up, and I'm good. You get wheeled into the recovery room, which I'm told you're usually in there for about 20 minutes. In a perfect world, I was in there for an hour and 20 because they were trying to stabilize my blood pressure.
So your blood pressure was too high, not too low. But when you passed out though, Like, you don't remember this, but
No.
did they tell you? Because usually when people pass out, their blood pressure's low.
Or maybe it was low.
Maybe it went low and then I don't know. But
I don't know.
That it's so scary that you don't remember any of it.
know.
You know?
They told my husband to go sit over there.
Yeah, yeah.
And he was like, oh my God, she died. Yeah. And then they told me I think they said they pumped me full of like 3 bags of fluid.
Yeah.
And I woke up feeling like I had a whole bunch of Botox put into because I was just so swollen.
Just taut. Like,
yes.
So you mentioned too, like this whole, like that this weight was lifted. And it truly, if you think about this, you're laying on your back.
Yep.
For the C-section.
Right.
They're prepping, we call it. They're preparing, but we're going to do a prep. So they're, cleaning your belly with all this stuff to keep it a sterile environment. They're putting a drape over you. They're making sure the monitors are good. Everyone's ready. There's time. So you've been laying on your back for a while. And then literally these 2 babies, they weighed a good amount, right?
5'15" and 5'11".
Snapdragon.
Yeah.
So you've had like, I can't do math, 10 to 11 pounds, right? Is that about? Okay.
Yeah.
10 to 11 pounds taken off of your big vessels.
Yeah.
And you've been laying down. You're definitely going to have some vagling response, right? Of your blood pressure changing. And that's totally probably what you felt too, right? Like, and how awesome. I mean, it's amazing how the body is. She has an epidural or spinal, whatever they put in you so that she really can't feel sharp stuff from typically the belly button down. You don't want it too much higher, but that's around the spot. But you could still sometimes feel tugging. Could you feel pressure when they were moving or getting the babies out?
A little bit.
A little, yeah. But no sharp stuff.
No.
Yeah.
No. And not even too crazy of the tugging. Really.
That's a good spinal or a good neuroaxial anesthesia, which is great.
And hopefully it was where my babies were positioned. So it was like easy kind of like, we'll just take baby A out and then,
They just came on out. They were ready.
Yeah, exactly.
They were ready to go. Okay, so then recovery-wise, you're in the recovery room. You're there long. Now you were there longer than normal. Yeah. You have this feeling of, I just call it tautness, like that tightness of your skin in a way.
Yeah.
When you were kind of like with it, right? When you started to really like the anesthesia or whatever, you're waking up and all this kind of stuff.
Yeah.
How long did that feeling and the swelling last for you?
Well, I'll tell you this. So I had the babies around 5:55 p.m. So let's just say 6 p.m. on a Monday.
Sure.
We left on Friday. So I was in the hospital for 5 days.
Yeah.
And I was great. They actually told me I could have left on Wednesday, but I was like, insurance is covering until Friday. We're staying until Friday.
And good to know how long your insurance will cover a stay. Like if you don't know that, then you don't know.
Do all of that due diligence.
Oh, yes.
Again, I think, me being a planner, that just like benefited to just my anxiety and just, the more you plan, the more you know.
Yeah.
And that's really like what you said, knowledge is power.
Yeah.
But yes, so the C-section actually wasn't that bad as far as like healing that up. But I remember calling my doctor. I'm like, when is this fluid going away? I mean, I look at pictures and I'm like, it was awful.
Wow.
I was a balloon. I looked way worse after pregnancy than, I had gone to brunch the Sunday before I had the babies. So, and I remember they were like, give it 3 weeks. And I'm telling you, on the 3-week day, and it was very weird. They're like, all of this swelling is fluid that we pumped you full of. And I remember they said I had like protein in my urine, which I think is part of that preeclampsia.
Yeah, for sure.
And they're like, you're either going to sweat it out or pee it out. And I'm like, okay. And then they also were like, drink all the water because you got to start to flush it out. And it was very weird. It would happen to me at night. And not really the sweating. It was the pee. I would wake up. I was so used to at that point for months waking up 5-6 times a night, going to the bathroom.
Yeah. And that's so interesting because when people get preeclampsia, part of the diagnosis, just like you said, is they have protein in the urine. Mm-hmm. And also when you check their blood levels, their creatinine is elevated, meaning their kidneys don't work as well.
Oh, okay.
So when they say you'll pee it out, you will. But if your kidneys don't work as well, you're not going to pee it out as quick as someone who has great working kidneys. Yeah. So you probably, the fact that you didn't get swollen at all during the pregnancy, that's fantastic.
Yeah.
And that's why when we talk about people above a certain age, as we age, our kidneys have been working for 40 years, right? So you're probably going to get swollen more because your filtration system, which is the kidneys, they might not work as good.
Right.
But when people get preeclampsia, their kidneys don't work as well. It's so hard and frustrating because you're like, why won't this fluid go away?
Oh my gosh,
right?
It was awful. Yeah, I couldn't even... I remember one of the biggest things they said after you have a C-section is walk. And luckily I had my babies
move around.
October 18th. So beautiful Arizona weather for walking. And I couldn't even wear my sneakers. I couldn't even put on my sneakers. They didn't fit.
Yeah.
So I had to wear like Birkenstocks on like the largest setting.
They're back in fashion now.
They were back in fashion, so it was fine. But yeah.
I love it. And then when you mentioned the preeclampsia part, did you check your blood pressures at home postpartum?
Yeah. So actually, going back to had the babies on a Monday, went home on Friday. All of my levels looked good. Babies were really good. I was still blowing up like a balloon, but they were like, give that time. And then Friday was my first night home, and my mom was in town, my mother-in-law, and they woke up the next morning like, how did you sleep, Sierra? And I just like tell it like how it is and how I feel. I was like, my heart, I feel like I'm having a hard time breathing. And I think one of the things they told me was blood clots are a common side effect. So my mom,
fluid on your lungs too.
Yeah. And so my mom, again, I think I get it from her of like, better safe than sorry, just go to the ER.
Yeah.
Just to make sure you're checked out. And I mean, I was only 5 days post having a C-section with twins and postpartum preeclampsia. The doctor was awesome. My husband and I were there for, of course, it was ER. So we were there for like 6 hours that Saturday. But they ended up running a whole CT scan on my abdomen.
And your chest and heart, kind of like your like chest area.
All of that. And they ruled out a lot of things. They said, I'm good. But they ended up putting me on blood pressure medicine. My blood pressure was still a little high, I think. And so I took that for 5 or 7 more days, and then we checked it, and then it was good.
So once you diuresed or peed off all that extra fluid, which we call third spacing, would you say that after you peed off all the stuff, is that when the blood pressures finally got better? Ish?
No, because I was still a balloon like literally up until 3 weeks.
Yeah.
And they had checked my blood pressure. I think I went in that following week and it was better.
Okay, good. This is my big thing too. It sounds like you had a great provider that followed through with seeing you postpartum and checking on things. That's a big thing. They've come out with these articles recently. It's like all pregnant individuals should be checked for their blood pressures during pregnancy and into the postpartum period. They're coming out with this like it's a new thing. That's not a new thing. That's like forever.
Yeah.
And especially if someone has postpartum preeclampsia.
Oh, yeah.
They should be checking their blood pressures at home, probably at least once a day. And because you might need blood pressure medicine. It doesn't mean you're going to need it for the rest of your life necessarily.
Right.
But you're still going through these changes. And I always talk to people about advocating in this postpartum period because that's sometimes when people in smaller towns or just in places where they might not have as good of a care provider like you did, that they get forgotten about postpartum.
Oh, yeah. They're like, you had the baby, you're good.
Yeah, it's a common thing. So if you don't feel right, particularly like if you, like that trouble breathing to me is like, man, there's fluid somewhere, it could be on the lungs. So that's why they check that and for a blood clot.
Right.
So you can't get that checked out usually in any kind of like a urgent care. They don't always have those kind of scanners.
Right.
So a triage area at a hospital that, hopefully to a hospital that cares for pregnant individuals. Because if you go to a freestanding ER that doesn't see pregnant people much or postpartum, you're still considered what we call the puerperium. It's like a weird word, but it's like still within that 6 weeks postpartum, you're still considered someone who just had a baby, right? So hormonal changes, different things going on. So it's great that did you go to the same hospital that you delivered?
We didn't go to the same hospital, but they do deliver babies. And again, luckily the on-call doc there was awesome.
That's right.
I mean, again, I remember he was like, well, I mean, you're still very swollen. You had just had a C-section. We can tell by that. But he was able to rule out any kind of underlying like issues.
Yeah.
But I'm still glad I went.
Yes. I mean, and you have to,
to relieve my nerves.
Yes.
My husband's nerves, everyone's.
Yeah.
And then also I had to be put on blood pressure medicine.
Yeah. Yeah. And I want you guys to know too, people think that when individuals are placed on blood pressure medicines that, it means there's something wrong with them. Like people are like, you eat
I'm like, am I
terrible
old?
food? Or you're like, It's so, I mean, I'm on a blood pressure medicine, but it's more for my heart rate and not my blood pressure, but whatever. It is what it is. But on a side note too, like, this is where I get into the whole, like, please don't judge a book by its cover. Like, don't look at us as patients, if you're a provider, and say, oh, you've never been on a blood pressure medicine because of the way you look.
Right.
Or you don't look unhealthy, or you're young.
Yeah.
And so you can't have had blood pressure issues, right? Make sure you know that. So like in any future pregnancy for Sierra, she needs to be on aspirin.
Yeah.
I mean, you do. Because if you've had a history of preeclampsia, whether it was during the pregnancy or postpartum, you need to take 81 milligrams of aspirin starting at about 12 weeks.
Yeah.
And so like, man, preeclampsia. I feel so many of my friends had it.
Yeah. And I guess the pre is a lot more common than the post.
To have it during the pregnancy is definitely, we see that more frequently than in the postpartum period.
Yeah.
However, I would be willing to like challenge if we could collect data on that. Because when you send people home, no one tells you to check your blood pressure at home if you didn't have it. Like,
oh, right.
You know what I'm saying? Like, had you not developed it in the hospital postpartum, you could have gone home and developed it within the first few days postpartum and not known it.
Yeah.
But you should be having a postpartum visit usually at 2 weeks and 6 weeks. Some people don't get a postpartum visit until 6 to 12 weeks.
Oh, gosh. Yeah.
That's way too long.
Yeah.
And you should be checking your blood pressure at home.
Yeah.
Particularly if you have symptoms, you're swollen or you have headaches or you can't breathe well. I mean, for sure.
Yeah.
Oh my gosh. Preeclampsia always gets me kind of riled up.
Yeah.
Because
I had never, that was one thing I had never even really heard of, or we didn't really.
Really?
No.
Okay.
I don't think, I mean, maybe.
I'll tell you this. Anytime I see a pregnant person and they have twins, my consultation is this. You yourself have an increased risk of diabetes, high blood pressure, such as preeclampsia, preterm delivery, and C-section.
And maybe they did mention that, and then it was like, okay, we'll check my blood pressure. And they're like, okay, it's good.
Yeah.
So I think it was probably in passing, something like that.
Yeah.
Of course, because I remember my follow-up. I'm like, so what exactly happened? Like, did I really die and then come back? Like,
how did that go?
My husband said I died. So,
well, and I love that. And that's the part too that I want people to realize too. There are great organizations that when you have a C-section, if something happened during it, that people kind of tell their stories. Like there's this thing called Mama's Voices, and you can kind of hear about other people's stories.
Yeah.
I've had people that had an amniotic fluid embolism on the table where they legit died on the table.
Oh my gosh.
And came back from it. And most people don't come back from that. Or a hemorrhage, right?
Yes,
where they bled too much and then they don't recall.
So yeah.
You know, and those things happen. And having another child in the future, it can be almost PTSD like when you get pregnant again of like,
totally.
I don't want this to happen again. How do I handle this?
Yeah.
So I just think we have to support each other, and talking about it definitely, I think, starts the conversation, right?
Absolutely. Yeah.
To just learn more. So well, Sierra, can you think of, we've gone through all of our questions.
I know.
And we've talked about a ton of stuff, but is there anything else that you want to bring up to listeners, or anything that you can talk about I like to circle back to impact all the time on like, how can we help people have how can we have a positive impact on others, and then they kind of pay it forward?
Yeah. I mean, I would say specifically with the twins, like just listening to yourself. And, you know, I always say I had an awesome pregnancy. I don't really have anything to compare it to. I loved being pregnant. I think there was a lot of variables that contributed to that. But a big variable that I think was my mindset.
Yeah.
I was, you know, even the days I didn't feel the greatest, I don't know what it is, but when I think of like on the devil's advocate on the side of like all of the women that want to get pregnant but can't, that immediately is just like, oh, well, I should embrace this. Or for me, it was a very strong likelihood that we weren't going to have any more kids. So this is going to be the only and last time I'm pregnant.
Yeah.
And I always knew, I don't know why, I didn't really have a lot of people tell me this, but I knew one day I would miss rubbing my belly, and I would remember just miss carrying them. So all those like really like kind of weekdays that weren't the best, or I didn't feel the greatest or look my best, like I always tried to look at the positive.
Yeah.
And that, I don't know, I feel like there is such a powerful connection of how my energy is to the babies.
Yeah.
I mean, I want to say that I had an awesome pregnancy and I loved being pregnant. And then I ended up having like really easy, good babies.
Yeah.
And I actually did have a lot of people afterwards, and they're like, yep, of course you have good babies because you had a really good pregnancy. That was my take on it.
Yeah.
So
I think I love the concept too of having a positive mindset.
Yeah.
No matter what you're challenged with. Like, it's not like every day was perfect.
No.
But you weren't going to let it kind of like, I don't want to say ruin it, but you weren't going to let it ruin the day or ruin the joy that you had of being pregnant.
Yes. No, correct.
Thank you for coming today and sharing your story with us, and having all the listeners kind of hear your story and learn more along the way.
Absolutely. It's a pleasure.
Thank you. Well, I hope everybody was able to expand their knowledge a little bit today, particularly surrounding twins, because we had such a great story to hear today. Also developing some skills and learning to advocate for yourself along the way. We are here to hopefully have an impact on you and your pregnancy. And again, as always, I'm Dr. Lexi, wishing you a happy and healthy pregnancy.